today with you is about neck pain, just some basics, okay, generally what I see day to day. So I'm the clinical lead physiotherapist at the London Back Pain Clinic, and over for the last 2 or 3 years with them, I've seen a lot of kind of neck pains, and these are the kind of pathologies I tend to see day to day, okay? So we're just going to go through some of the basics. So first of all, today's discussion will talk a little bit of a background in neck pain, why some of these pains occur, the anatomy, to get a little bit of better understanding of the structure of the neck and the upper back, some common misconceptions. All right, so some common misconceptions. And then we're going to talk about what the actual issue problem most likely is, what not to do, things not to do, things to do, and some exercises to kind of go home with. Now, first of all, let's talk a bit about the background. Now, neck pain is very common, so it's not abnormal to actually have neck pain. 48% of a population in a lifetime will actually have neck pain. 26% of that population will have it in 1 year, and it ranks 4th in the global disability scale alongside lower back pain. It tends to happen in higher income countries, but low to mid-income countries are on the rise, and this is generally because of office-based kind of lifestyles and more sedentary lifestyles. Generally, neck pains tend to go away after short periods between that 1 to 4 week marker. However, they do tend to persist sometimes, and we're talking like the longer ones, and this is why you might be here, is these more longer persisting kind of pains that kind of keep reoccurring basically. So some common causes that might be happening. So first of all, a sedentary lifestyle, okay? Our bodies are made to move, and we don't move them, okay? They're going to stiffen up, okay, and it's going to punish us. Long periods of poor posture. Now, poor posture is probably the really big thing that I see it causes pain, especially working in the city and everyone's sitting there hunched over their desks, okay? Their necks are going to get major issues from that if they're doing that for long periods of time. Previous accidents like car crashes where people are sustaining whiplashes are quite common still. Previous injuries like shoulder injuries, frozen shoulders, impingements, elbow pain sometimes, hand sprains, even sometimes lower back pains as well. Anything that's going to change the way that you kind of move, your biomechanics could lead to these kind of neck pains going forward. And a big one is kind of repetitive jobs or with repetitive loads. So for example, a hairdresser where they're kind of always up and their arms are always lifted up and their heads are always looking down at the person. Manual workers bending and picking things up to lift up. Desk-based jobs like I've mentioned before. And for example, dentists when they're looking down into the person's mouth the whole time and their neck is bent, putting major amounts of stress through their neck. So let's talk about a little bit about the anatomy, because the more that we know, the better. Okay, so we can understand what's going on. So the cervical spine, is what the neck's called, is broken up into 7 pieces. So it's going to be called C1, C2, C3, C4, C5, C6, and C7. Generally, most common injuries tend to happen around the C5 to C6 region. Sorry guys, throughout this kind of presentation, I'll be using the mouse to kind of guide where to look at. Now, if you look at these little yellow areas, these are the nerves, okay? And they tend to correspond to 2 segments. So it might be C5, C6, C6, C7. And this is an MRI of a healthy neck, okay? So you've got the bony segments in between here, and in between those are those little cartilage discs, okay, that everyone's heard about. And in between here is where we have your spinal cord, okay, where the kind of nerves start to kind of protrude from. So this is kind of a back view of the kind of cervical spine. So the things to note of here are these little joints that join each segment of the spine together, and they're called the facet joints, okay? And we'll kind of speak a little bit later on then. Now this is the kind of top-down view. Now these are the famous discs, okay? So you've got your little cartilage ring and the little J-like substance called the nucleus pulposus, which is inside here. And you've got your nerve root here and your spinal cord here, and your facet joints will lie around this region here. This is the kind of looking for the neck from the front. Again, we've got our cartilage discs here and our bony segments here. The facet joints are on the other side, and you've got your nerves poking out with your arteries and veins going up into the brain. So again, the neck is a really important area. it's got to be nice and protected because they've got major blood supply to the brain. Now, common injuries that I'm going to talk about today. First of all, disc injuries, facet joint injuries, arthritis, and trapped nerves. Okay. So generally, disc injuries. Okay, so a lot of people have heard of it. The most common disc injury is what we call a herniation or a disc bulge. Okay, where the little jelly-like substance pushes out and can compress on that nerve. The other thing that can happen is what we call disc degeneration, which tends to happen in little older ages, where the water inside the disc is basically kind of reducing and the disc is becoming more and more narrow. Okay. Now, here's a nice little picture of an MRI here showing a disc kind of bulge, and you can see on that C5, C6 region, it's kind of pressing against that spinal cord there, and that's why sometimes people might get that kind of trapped nerve feeling down the arm, okay, or some sensations down the arm, or even sometimes some pain. Now, talking about a bit like arthritis, some facet joint regions. So the whole point of the facet joints is they kind of articulate movement in the neck, so they kind of help the neck move. Now, a lot of the time, if the joint's not moving, it actually causes more wear and tear because our body naturally wants to move, and it naturally produces a thing called synovial fluid. And now that synovial fluid basically lubricates those joints. Okay, so yes, doing more activities can cause more wear and tear, but it's actually worse to not do anything. So sometimes resting is not always the best way forward. And as you can see, the facet joints here are also very close to the nerves. Facet joints tend to happen alongside with those disc degenerations where the discs tend to narrow because there's less movement around that segment, okay? So a lot of the time what happens when there's less movement, this gets irritated and builds up, and that inflammation builds up, which can irritate the nerve, which we'll talk about in a second. So trapped nerves, okay? Now, a lot of people think they have trapped nerves, and it's not necessarily the nerve is trapped. It's most likely it's irritated. It's irritated by the disc or the facet joint itself, okay? And depending on what region, depends where your pain comes from. So a lot of the time, say for example, we talked about that C5, C6, and I know it's very common, and C6, C7, we get that kind of achy kind of shoulder around the shoulder blade and the tops of the shoulder around here, and we want to play with it the whole time. Sometimes it's actually a nerve being irritated, or the disc or the facet joint getting irritated, and it's just referring pain into that region, okay? Sometimes it's not the muscle, it's actually the segment itself being irritated, referring pain. Now, like I said, facet joints can irritate the nerve, the disc itself can irritate the nerve. Depending on the severity, depends on the symptoms. Now, at worst, you'll probably get lots and lots of shooting pain down the arms, weakness, numbness, and if it's unremitting, then I would probably sort of seek kind of scans and probably seek kind of more orthopedic help from orthopedic consultants. However, the majority of us will probably feel that tight nagging feeling, which is generally very controllable. Okay, so some common misconceptions. Okay, so I see this a hell of a lot in my practice, and the more that you know now, the better you are going forward. The more you understand, the more it's going to be easier for you to kind of tackle and move forward, right? So, my back muscles are tight. Okay, so I used to believe this myself, and you kind of get that tight, nagging feeling around the tops of your shoulders, it's around that shoulder blade. You think your muscles are tight and they're overworked, and you need to rest them or you need to stretch them. Well, in actual fact, because of our general posture, most of the times our ears tend to sit forward from our shoulder, okay? So this is the upper trap muscle here, okay, tends to be the big culprit and takes all the stick, basically. And the muscles around here called the rhomboids tend to take a bit of stick as well. But generally, because of our posture being slightly rounded or our head slightly forward, in actual fact, these muscles are not necessarily shortened and tight, they're actually probably lengthened. So they're actually under stretch a lot of the time. They're overworked, okay? And like I said before, a lot of the time it's that segment, that C5, C6, C6, C7, being irritated from the facet joint of the discs, referring pain into that region, okay? So it's not necessarily the muscles, it's more likely to be the segment or that muscle being overstretched, okay? A lot of the times what we see is actually the front muscles tend to be tighter, dragging us forward, and the muscles around the back tend to be lengthened and weakened. Now, the other big thing is old age is the reason for my pain. Okay. Now we know lots of I know lots of 60, 70-year-olds, 80-year-olds where wear and tear is more common in the neck and is shown to be more common in the neck that don't have pain. Okay. In actual fact, 90% of people over the age of 60 will show some wear and tear in the neck. Okay. Which brings me on to my next thing, that MRIs tend to be quite misleading. Sometimes we kind of focus on that we have a disc problem, we have a facet joint injury. When actually, in fact, a lot of the time, people tend to be asymptomatic. The kind of study from Brzezinski here showed that 90% of people over the age of 60 have some degenerative changes, but only 10% actually have any pain from it. So we know we shouldn't always focus on our MRI results. Now, there's lots of other bits of literature that kind of say that, but we'll go on to the next bit. So the other thing is, like I said, I need to stretch my neck. In actual fact, sometimes you might need to strengthen those muscles. And the last thing that I see quite a lot in my practice is my spine is out of alignment, okay, or it's rotated or out of much. Now, if anyone's done a physical examination and they kind of pick that up, it's most likely not going to be true. You probably need, if anything, you're going to need a postural X-ray, and even then that wouldn't necessarily show it. So if someone says you're out of alignment, just take it with a bit of a pinch of salt. Don't get too scared about it. Doesn't mean you can't improve on your neck pain. So what is the actual problem? Okay, so generally it's because we do things that aggravate our neck. For example, sitting with bad posture, which causes a lot of mechanical stress around our neck, or we carry things that are too heavy for us, or we, for example, wear we wear bags that go across us, or we wear too heavier bags, or we're driving with our arms up here, we've got a phone up in this position. We're doing things that aggravate our neck, building up that inflammation, which then increases our pain. The other thing is, like I said before, those muscles, particularly the ones around the back that keep us upright, are weak. Okay, the muscles around the front are shortened, dragging us forward, and what we call the deep neck flexors around here that help us bring our neck back into this position tend to be weak too. So that contributes to a build-up of inflammation because we're just putting our neck in a kind of mechanically poor position. So what things not to do? So like I said, and I'm going to keep repeating it, posture. Long periods of bad posture will agitate everyone's neck, okay? Not now, may not now, but I just wouldn't tempt fate, okay? Poor exercise choice and form. So we've gone to a trainer or we've seen something online, we might have been given the wrong exercises for us, okay? We've lifted too heavy, or we've had poor form and we've not kind of checked it, okay? Or we keep doing an exercise that keeps agitating. And in this case, I would probably go and see someone to kind of get some advice to make sure our form is good, but also, or to change the exercise that does the same job, but doesn't aggravate our neck. Again, to stop that buildup of inflammation causing that neck pain. And like I said before, stopping painful activity. So you've got to figure out, say, for example, if you're sitting there washing the dishes and your head is down like this, or you're looking at your phone all day like that, and you're like, oh, my neck hurts. Write down little things. Write down, that, oh, okay, my neck started to hurt after looking down at my phone screen for 5 minutes. Okay, have a look at it. Write it down so you can avoid it. Stops that build-up of inflammation. Or you can monitor it and bring your head up or your phone screen up. Looks a little bit odd if you're sitting on the tube and your hands up here, but it will make a big difference going forward. So what things to do? Okay, so first of all, exercise targets. Okay, so I'm a physiotherapist. I believe in exercise. Okay, so like I said before, we're going to strengthen those inhibited back muscles. We're going to move those stiff joints. We're going to stretch those shortened chest muscles. Okay, And then lifestyle changes, like I said before, understand your pain, write down what you kind of find triggers your pain, and kind of learn about your pain. Become conscious of your posture. I don't mean like you have to sit there all upright the whole time, yeah, because it's very hard to maintain. But just be a little more conscious. If you feel like you're sagging down, you know, oh, I'm sitting there, sit yourself up, and it will help relieve a lot of pressure. Or if you feel like you've been sitting down for a little bit too long, stand up, have a walk around. You know, it's good to help kind of refresh those postural muscles. And then live a more active lifestyle. So don't be scared. Just because you have neck pain doesn't mean you can't be active. Obviously, some activities, if you've got quite bad neck pain, might be out of the question at the moment, but it's something you could work your rehab program to going forward. Okay, so you know, maybe if you've got quite bad neck pain, rock climbing might be a bit difficult at first, but you know, you work towards that kind of thing. So we're going to get onto the exercises here. So we're going to have two different things. Okay, so we've got some desk-based or sitting-based exercises, which we can do literally anytime. So there's no excuse not to do these, okay? Then there's the home-based exercises. So with the desk-based exercises, preferably, and they're best done every 1 to 2 hours. Home exercises, generally once a day. Now, just a quick little disclaimer. If these exercises might not be good for you, okay? If they I'm kind of doing it for a more generalized kind of public, like I see in my clinic. So if it's not working for you, again, go and seek help, okay? You've got to modify it to suit you sometimes. Again, learning more about your own neck, okay? So we're going to go through them now. Okay, there's a little bit of a list between the two. So the first exercise, so what I'm going to do, guys, I'm going to just unshare the screen for a second. Hold on a sec. Just going to unshare the screen. Oh, there it is. And then I'm going to show you the exercise. Can everyone see me at the moment? Yeah, just a thumbs up. Perfect. Okay, cool. So the first exercise, and this is probably my favorite for next, okay? I do this all the time myself, all right? So I'll be nice and upright, shoulders are back, okay? You guys can join in, by the way, you know? What I'm going to do is with my chin, stop that kind of poking chin posture right here. Sit myself upright, keeping my chin parallel, just bring it, my ears towards my shoulders. I'm going to hold that for about 7 seconds and then relax. Hold and relax. Okay? 10 repetitions, guaranteed. If you can do anything, do this exercise, okay? So it can really improve the majority of the people that I see, okay? All right, let's go back into the screen share. So the point of that exercise is, so the point of that exercise is that it kind of mobilizes this little stiff area between the upper back and the neck region, which tends to get the the most kind of mechanical pressure. All right, and it also strengthens that, what we call that deep neck flexor that helps keep us nice and upright. So my next exercise, so you need a band for this, or you need a band, a towel, anything like that. Scarf is generally quite good as well. Now again, it's to kind of mobilize that kind of stiff upper back neck junction, okay, that gives you a lot of pain. So you get your band, okay, you put it around that kind of stiff region, okay, you pull. I like to pull downwards, some people like to pull upwards, okay, and then you just look back, pause at the end, and come back slowly, okay? Up and down. Again, just try and repeat, I'd say with that one, 7 to 10 times, okay? Now, if you get a bit dizzy with that one, you might want to not do that, okay? Sometimes people, when they tilt their head backwards, can get a little bit dizzy. And again, if it's sharp pain, I wouldn't do that one, okay? All right, maybe just stick with the kind of chin tucks. Now, my other one is, now the upper back has a big kind of role to play, okay? Because a lot of the time that becomes quite stiff as well, okay? Because a lot of the time If the neck goes forward, so does the upper back, and it gets curved. Okay, so what we've got to do with this exercise, these two exercises, one to kind of move it and loosen it up, but the other one to open it up, stretches out the front muscles, but it also reverses that curve. Okay, so all right, so you're going to have your hands like so. Okay, you lift up your elbows to the sky as high as you can, hold, and then come back down slowly. Okay, so that's the extension portion. And then the other one is elbows like so still, and then going side to side. Okay, and again, really try and go as far as you feel comfortable. But try and push it a little bit. Okay, to try and really loosen up those stiff joints. Okay, remember our bodies and our joints, they love to move. Okay, they want to move. Okay, so this exercise in particular is only really suitable for a when you've got a stiff neck. Okay, when your neck is basically having problems moving right to left. Okay, so say for example, I'm having a problem going to the right. What I'm going to do is I'm going to get my band or my scarf again. Stop the sound. Okay, so I'm going to put basically the band across my left cheek, okay, and it's going to be in my right hand. It's going to come across my face like so. This hand is pulling down. It's going to be 50-50 pull, okay, and I pull across, and as I move my head to the side, yeah, I push into it, give it a little bit extra push, and then back. Push, and then back, okay? And where you want to be aiming with this band is around this region here, okay? That C2 region up here. Because a lot of the time, rotation, the majority of rotation happens at that C1, C2 region, okay? So this is a really good exercise if you've got a stiff neck going side to side. Again, make sure you're in good posture for when you do this, okay? Okay, so now it brings us on to our strengthening exercises. Now, again, these are very basic. Some of you might be doing harder stuff. However, the point is the principle, okay? Now, with this exercise, you've got to learn about your capabilities. If you go too heavy, you might set your arms, you might set the pain off, okay? So start off with light. The whole point is it helps to move that shoulder blade, activates what we call the rotator cuff muscle, which helps to stabilize our shoulder blade. And it also engages these weak muscles around the tops of the shoulder and around the shoulder blade, okay? So it's a really good exercise. Seems so simple, but it's very, very effective. Now with this one, because we're working more on stability, you want higher rep ranges. You want to get to that 15 rep mark range, okay? But if you're new to this, you start off with as many as you feel comfortable in doing, yeah? If your form or your technique starts to go, then you stop. And that's going to be the principle for all of these exercises, okay? So literally nice and basic. Okay, I've got some light weights here. Okay, and I'm literally just going to lift up. My head is nice, my chin's parallel with the floor. I lift up, I pause, try and get to 90 degrees, and then come back down slowly. Okay, you want to be controlled. You want to be sitting there flapping away. You want to be up, controlled, pause, and come back down. Okay, think about your posture. Think about, you know, tensing your tummy slightly to get that core nice and engaged as well. Lift up, pause, come back down. Nice and simple exercise. Okay. Now, this exercise, this is a kind of a two-parter, right? So we've got, this is to help strengthen up the rotator cuff, but it'll also help open up our chest, which is going to be very tight, okay? And the rotator cuff is very, very important, okay? Because if it's weak, then we're going to have unstable arm movement. So when we're going to pick things up or lift above our head, yeah, those other muscles are going to be kicking in too much, okay? And we don't want them kicking in. We actually want the rotator cuff to try and do, you know, to try and keep that shoulder stable. We don't want other muscles compensating, okay? So we're going to start off with what we call the external rotations, okay? I'm sure if you've had shoulder pains before, then you've probably seen this exercise. Elbow nice and tucked, okay? Thumbs up, Shoulders up, chin parallel, open up the chest. As far as you feel comfortable, you hold for a couple of, like a second, and then you come back in slowly. Make sure those elbows stay nice and tucked, okay? Keep those thumbs up, guys, keep those thumbs up. Okay, remember, keep that posture good. Don't bring your head down. See that a lot? Out, hold, come back in slowly, okay? And make sure those shoulder blades are just slightly back. They're not squeezed back, they're just slightly back, okay? All right, now, medial rotation. Okay, so again, you're going to need probably a different type of band for this one. Just shout out, guys, if you can't see me doing this one properly. So I'm going to do it with my left hand here. It's the exact opposite to that movement. So I start out, okay, and I just bring it in towards me like so. I pause again, and I come out slowly. And the reason why I come out slowly is it will help stretch out that chest. It will also work that muscle harder, okay? It's a little bit more challenging. Okay, if it's a little bit too tough, what you might want to do is just hold that tension like so. But if you've got the strength, bring it in and come back out slowly. Okay? Again, with these ones, because they're tiny muscles, these last two exercises, you want to start with light, okay? If you can do 10 or 15 comfortably, 3 sets, then you can move on, okay? But again, I would say with rep ranges with that one, start off with your own capabilities, but you want to try and aim for that 10, I'd say 12 to 15 rep ranges on this one. Okay. Okay, so this one, again, now you don't have to have a band on this, but it does help. You can use also some light weights or some cans or something like that. Again, we're strengthening up this time muscles kind of on the mid back, okay, the rotator cuff again, and yeah, just to kind of, and it opens up the chest. Again, one of my favorite exercises. So let me show you how to do this one. So you get your band. So like shout out if you can't hear me, guys, or you can't see me. So you get your band and you just open up your arms to the side, squeezing those shoulder blades together like so. So I know you can't probably see me very well from the side view. I'll turn around and show you the actions that I'm doing. I'm just bringing my arms back like so, squeezing, again, holding like so. It's a good time to do a chin tuck, by the way. Okay, so the movement is like so. You bring your arms back, squeeze those shoulder blades and come back. As you get stronger, you can move your hands backwards like so. If you have some weights, you don't really have some cans, okay, which I'll probably start off with when you're starting out. Head down, chin slightly tucked, and then you just lift up, pause, and come back down. If that's a bit too tough, just bring them backwards slightly like so. Okay, and if you've got a bad back, you can do the same sort of thing, but on the floor. Okay, so bringing us to our last exercise, another really important exercise, again, one of my favorites. A lot of people really don't know that they have tight chest muscles, okay, and tight front of their shoulders. And these things, if they're tight, they're going to come over like so. They're going to push those shoulder blades out, stretching all those muscles, bringing your head forward. So, you know, it's a really important muscle to stretch out, okay? So let me show you how you do it. Now, I like to do it on a door frame. So I'm using a door here. Just shout out if you can't see me. So you're going to get your door. Okay, you're going to get your hand. Your hand is going to be in this position, okay? Now you want your elbow and your hand in contact, okay? Hand, elbow in contact. You step forward, hand like so, open up the chest, okay? And just look forward, okay? And you should feel a nice little stretch in that chest muscle. Now I like to hold that for about 30 seconds, preferably for 3 sets, okay? If it's painful and you can't get your arm into that position, another way of doing it, or kind of like a level a little bit low below it, get your hand like so, palms face out, hand against the wall, step forward, and then just turn out slightly to feel the slight stretch around the front of the arm and the front of the shoulder, a little bit of the chest, okay? And then as you get stronger, then you can bring your arm up into that position. Okay. Okay, hang on 2 seconds before we have any questions, guys. So just a quick, again, just to remind you, now those last exercises, now they're not the kind of be all or end all sort of thing, but they're the start, okay? Now, with regards to people's neck pains, you've got to give the exercises a bit of a chance, and you really should kind of progress them going forward, if that makes sense, because they might become easier. So they should become easier. If you do them, they should become easier. Your muscles should get stronger. So, you know, it's good to try and find new ways of challenging those muscles that have been weak for such long, especially if you've had a lot of pain for a long time. It means that your muscles are going to have gone to sleep. They're not working correctly. You've got to wake them up again. So you've got to give them the chance to kind of have that whole process. Okay. Now, like I said, we're probably all at different levels here. Okay, so we have to figure out what is the best plan for us, okay? You can start with this and see if it works for you. However, okay, if it doesn't quite work for you, I would recommend going to see someone, going to see a physio, okay? It will massively help, okay? Because then you can understand and then you'll have a nice base to start off with. Make sure you have a goal going to, I want to, you know, be able to do this certain activity, and then it gives you something to work your rehab towards. Other things to kind of help you guys that I seem to find that really helps people is Pilates, and yoga is also a very good time of form. Again, I would start off with low level if you've never ever done it before, and make sure you tell the instructor that it is your first time, or may even see a one-to-one specialist, and also tell them about your injury as well. Other things to think of, sometimes neck pain has a big psychological component to, so seeking kind of counselling help has actually shown to really help with neck pain. And right now we're ready for some questions. Hold on, guys. Has anyone got any questions?